Thank you very much, William. As usual, I always have to adjust this. Good morning, everyone. Madam Chairman, Prof. Rena, thank you very much for granting me this opportunity to talk about, if you like, the marrying of two of my biggest passions, which is IT and medicine. I think that after 65 years of independence and 60 years of this medical school, a lot has transpired in terms of healthcare delivery and the teaching of medicine. And it is important that as we develop as a people, we do not remain static in the methods that we have acquired several years ago, because at least I do remember that since my parents had been in medical school, the infrastructure that we have hasn't changed that much. It's the same infrastructure that I came to meet when I came into medical school. And there I say, if we are not careful, if any of my children should decide to come, they may also meet the same infrastructure that we have here. But things have changed. And so as a people, we must also evolve in our methods. And so I think that's the theme for today. It's very apt. And we'll be having 3 different sessions. Mine starts with the digital revolution in medicine. And I think that we should be able to look at it well so that we can plan for future innovations, not just in the practice of medicine, but also in the teaching of medicine. So as has been advertised, my topic this morning, it's on the digital revolution in medicine. I belong to the class of 2003, and I'm proud to represent them here today. Can we get... Right, so I'd like to premise my discussion with a quote that was made by, or a comment that was made by a British physician, John Forbes, in 1821. He made this statement: that it will ever come into general use, notwithstanding its value, is extremely doubtful, because its beneficial application requires much time and gives a good bit of trouble both to the patient and the practitioner, because its hue and character are foreign and opposed to all our habits and association. This statement was made in 1821 by a British physician called John Forbes. What was he referring to? He was referring to Right. He was referring to the stethoscope that had been invented by the French physician René Laennec. Now, René Laennec had invented this device because he was a bit uncomfortable to the fact that when he had to examine female patients, he had to put his chest close to their breasts so that he could listen to their hearts. And the picture describes what used to pertain back then. So he felt it was a little bit uncomfortable to his female patients. And I dare say to him himself. So he did invent this particular device. Now, a lot of people, not only the British, but lots of people were a bit skeptical about this device that the French physician had developed. But as we all agree, the stethoscope has now become symbolic with every doctor. And it's wherever we see it, we know that there's a healthcare professional nearby. So this is the stethoscope. And this is something that has been with us all through the practice of medicine. And over the years, it has evolved to become something else. That looks like this now. I'm by no means advertising for Litmans, but this is what the current stethoscope, or the modern rendition of a stethoscope now is. Now, you have a device that when you look at the head or the bell, has a digital LCD screen that allows you to counts the heartbeats for you. So you now don't have to look at your watch and count heartbeats. It shows you the heartbeat of the patient, the heart rate of the patient. It also allows you to hear the sounds as clearly as possible. So it reduces the noise. If you like, it takes away the unnecessary noise and lets you focus solely on the heart sounds or the breath sounds that you want to hear. What is even more important for us as teachers is that it even allows you to beam the heart sounds that you are hearing to your students. You can even record them and then use it for teaching at a later date. From something that started as a tube, which people doubted, it's now evolved over time to become a very valuable and even, if you like, IT-enabled device that has come to make the practice of medicine easier and more effective. And that is the model and the premise on which we'll base our discussion on. We'll look at how things have changed over a period of time. This is the outline of my presentation. We'll be looking at the history of the digital revolution. We'll look at the application of digital revolution in healthcare. And then, obviously, we'll look at the barriers that there are in adopting the, if you like, the revolution that is ongoing. And then we'll look at some new and emerging trends when it comes to digitalization. Now, before we get to my next slide, a couple of weeks ago, I was having a discussion with my son, and I was telling him how in our days, there used to be just one TV station in this country, GTV, which stopped at 11 a.m. with a pause for reflections. After the pause for reflections, General Assassine was played, and the TV went offline. So the following morning, I don't remember the time, 8, 7, and then he asked me, so then what do you do? I'm like, we go to bed. And he found it very difficult to believe because currently in his world now, there are so many TV channels, more than he can ever dream to watch. He has access to on-demand entertainment. He's got Netflix, he's got YouTube, he's got Hulu. And he plays games in real time with his friend who lives just across the street. So for him, it's very difficult for him to comprehend that we had just one TV station at that time. And that in itself is a testimony of the things and the changes that have happened to this day. In our world today, we are now living with things like self-driving autonomous cars. And this is estimated that by the year 2020, self-driving autonomous cars, if we implement them, will reduce traffic congestion by 30% because we'll have 30 less vehicles walking on our streets or driving around in our streets. It will cut transportation costs by 40%. It will improve walkability and livability because now you have less cars driving on the streets and more space for people to walk in. It will free up a lot of parking lots, and then ultimately for us and our very existence on this earth, it will reduce carbon dioxide emissions by 80% worldwide. And that is something that technology affords us now. Stem cell research. Stem cell research has shown a lot of promise for us. So now we can look at using stem cell research for drug development, safely for drug development. We can use it to test the toxicity of drugs that we are developing. We are now using them for things like bone marrow transplants for patients who have got leukemia and also people who need to replace chemotherapy. We are using them in neurology for us, the physicians. We are using them for things like the management of Parkinson's disease and strokes. Heart muscle cells are now being used to manage heart diseases. And then for those who have diabetics, there's a lot of promise on the use of stem cells in the production of pancreatic islet cells for the treatment of diabetes. And so research into stem cells that has been afforded by the current technology that we have now shows a lot of promise in our management of our ailments. You know that these days, everybody has got one biometric device or the other. And we are using them for interesting things like unlocking our phones, our computers, voter verification during elections. We are using them to conduct financial transactions. And it's also allowing us to have access to secure areas. Once again, this is technology that has used our unique features granted us by God and is using it in some of these industries and arenas. We now know of drone technologies. Drone technology has become very important in our lives now. Our kids have them, they fly them around. But when we come to health, for at least for the past 2 or 3 years, we've had zipline technology in this country that has been used to deliver essential medicines, blood, and vaccines as well. So Zipline, according to their website, says that since 2019, they have made more than 50,000 deliveries, including more than 1 million vaccines, and claims its services reaches about a third of the population of Ghana, which is about 12 million. Okay, so this is technology that is now has improved access to areas that previously we didn't have access to, right? And then now for the agriculturists, they are using drone technology to estimate crop yield, to be able to tell us how much of a yield we should expect for a particular planting season. Or they are using it to also identify diseased crops, and then using the same drone technology to deliver fertilizers, herbicides, and what have you in a much more efficient way. So technology has really helped us in all facets of our lives. And the single most important thing that led to this happening is what we refer to as the digital revolution. And that is what we shall delve into and see where we have come from what we were then to where we are now, and its applicability to the practice of medicine. So, in school we learned about the Industrial Revolution. So we had the first revolution, which resulted in mechanization and the production of the steam engine. This happened in the 19th century, in the 18th century, starting somewhere in 1973. We then moved on to the second Industrial Revolution, where we had now had electricity, production lines, and mass production. So with it came, with the development of electricity, oil, and gas, we now had good energy to be able to sort of mechanize and then develop other technologies that helps us in all facets of our life. Then, another century afterwards, we came to the third industrial revolution. And it is believed that this third industrial revolution is actually the digital revolution. And this started somewhere in 1969. This is what we call the age of computers. And the precedence of the transistor led to the age of computers. And then afterwards, from the age of computers, we came to the World Wide Web, which is now a big part of our lives that we cannot do without. Now they say, and some people argue, that we are now in the fourth revolution. The fourth revolution now comes with things like artificial intelligence and big data. And so we'll look at that in terms of how it affects our practice and teaching of medicine. Sometimes technology can fail. Okay, so I've got a timeline slide that tells us from where we've come from with respect to largely the digital revolution, which is the third industrial revolution. It's a bit of a busy slide, but I'll just point out some of the interesting things that happened, and largely with respect to us in the practice of medicine. So if you look at 1950, and I'm sure it's difficult for you to see, in the advanced world, we actually started having pages for doctors. Doctors started getting paging in facilities so that they were called as and when there were issues that needed attention to. By 1969, the military had developed what initially was referred to as DARPANET, which eventually became what we now know today as the World Wide Web. By 1984, the first mobile phone was launched. It is interesting to note that the first mobile phone costs $4,000. It took 10 hours to charge, and when you are fully charged, you could only talk for 30 minutes. Juxtapose that to now, where you can buy a very good smartphone for less than $100. You can charge it rapid charge in less than an hour or two, and your battery can last you the whole day. So that tells you where we've come from and the developments, okay? In 2000, broadband became largely available, and we also formed the basis under which all the developments that we currently are enjoying now was based upon. And then when you move to, say, by 2010, one of the commonest commodities that we have, which is your cell phones, Apple launched their first iPhone, iPad, and all that from 2010, all the way now to 2011, where autonomous or self-driving cars was mooted by Google. And now, present day, we are living actively in the information age, where everything that we do is driven by data and access to information. We are now in the fourth industrial revolution, and we are talking about things like big data, Internet of Things, wearables, and artificial intelligence. That is where we are now. So the question remains that as a people, and looking at our general status in terms of at the world stage, some of these things look very lofty, and the question is always asked that, considering the fact that we are still struggling with bread and butter problems, or if you like, brick and mortar problems with regards to healthcare delivery, should we really be looking at some of these fanciful stuff? Should we not be concentrating on dealing with our malarias, choleras, and all that, and leave these fanciful stuff to the developed world for them to pursue on our behalf? And my response to it is that it's even a question that we need to ask. We are in the era of the Internet of Things. We live every day of our lives by our phones, our smartphones, our computers. Everything is being managed for us, one way or the other, by connected systems. So it's not even a question to be asked. The question we should be asking ourselves as a people who come from the low, if you like, low middle income, or resource challenged areas. The question is, how do we leverage on this technology in order for us to be able to make meaningful use of it? Because if you look at our lives now, take for instance WhatsApp or Telegram. This is something that even in the practice of medicine now, we use regularly to practice medicine. I have my residents, medical officers, sending me images of ECGs, chest x-rays, MRIs, for us to look at and then give them input in terms of what the next steps to do. I happen to be on the floor of dermatologists. So anytime I see a case that I have an issue with that I cannot recognize, I take a picture of it and I send it to them and I ask them, what is this? They will look at it and come back to me with some list of differentials, and then I proceed subsequently with the management of the patient. So it is something that we are already using, whether unofficially or officially. It's something that we are doing. We have access to online repositories, guidelines, like Medscape and UpToDate, which we are constantly using to enrich our knowledge and also to manage our cases. So for me, really, it's not a question of why we should do it. It's a question of doing it and doing it well so that we do it within our means and have maximum impact on the management of our cases and then in the teaching of medical students as well. So when we look at the need for digitalization in healthcare, obviously there are certain things that underpin them. The human brain, and even for the sharpest physicians amongst us, we cannot keep up with the exponential growth of knowledge that we currently have and what is forthcoming ahead of us. I remember as a medical student, one day I had gotten home and I was reading one of my tests and I couldn't remember exactly where it was. And my mother, who's a pediatrician, said that in their days, they used to know the page numbers of where what was. And I looked at her and I told her that in your days, you didn't have interleukin 1, interleukin 2, HLA, DR5. All those things didn't exist. But in my time, it is there and I need to know them. So obviously, the rate at which we are churning out information in medicine, there's no way any human brain can store and keep. And therefore, it is important that we realize that we can do so much and then it is time for technology to step in. So as I've already said, we cannot keep up with the rapid changing. There's the information that has been generated, but that information that we generate is also rapidly changing. If you take COVID, for instance, when COVID came, there were initially some theories. Few months down the line, those theories were debunked. New ones came, and we are still debunking a lot of them as we move along, because as the information comes, right, from all the various places that you are harvesting the information from, our outlook to some of these things changes, and nobody can keep that in their minds. So we need these systems to help us. And then obviously we now have a secure way of information exchange amongst the various facilities that we have. And that is the advantage that IT brings to health. Let us not forget that the first computer that took the man to the moon is less powerful than the cell phone that you have in your pocket now. And once again, that is another illustration of the change that has happened. So if we look at digitalization and IT for that matter, it helps to connect the various health systems that we have currently available. Okay? There's integration of information from all the systems that you are gathering data from, which we call big data. Big data is a structured data that we get from the nursing station, doctors, physiotherapists, pharmacists, mortuary men. All of them are generating one data or the other. Okay, unfortunately, we are still analog, so we do not really appreciate it. But imagine that all this data is being coalesced into one central place and being analyzed. There's a wealth of information that we'll get from there that can only shape our practice better and make us more efficient. IT gives us ready access and the use of rights of information for patient care. The other thing that it does is that it also provides information to our patients. It makes them more knowledgeable. So when they sit in front of us, they are able to discuss their problems with us from an enlightened position. I know there are some people who do not particularly like the fact that these days our patients go and ask Dr. Google, and then they come to us with all sorts of questions that we may term as being silly. But I see that as progress, because information is now out there, and people can see them, read them, inform themselves, and when they meet with us, we can have a very good discussion with regards to their health care. The other thing that it does is that it allows for better forecasting. So for instance, this hospital, we should be able to know how many people have come into the hospital today. What ailments did they come with? We should be able to look at it over a time course period of over a year and compare it to the year before. It allows us to plan for logistics. What medicines should we buy at a particular point, at a particular month of the year, for instance? What sort of illnesses should we prepare for? What sort of things should we have in our emergency rooms for a particular month of the year? Because historically, we know that the data shows that when it gets to June, July, these are the sorts of illnesses that we will get. So we are better prepared for it. Analog systems cannot do this for you. It's too much trouble. But if you have a digital system in place that is harvesting all this data, it makes it easy at the click of a button for you to run these reports. And now that we have artificial intelligence, it's able to even make some predictions and say that, you need to prepare for this, you need to prepare for that. And that is where the practice of medicine is going to now. So let's look at some applications. So we have 3D printing. 3D printing allows us to produce prosthetics that are specific for a particular individual, not a one-size-fits-all prosthetic. Okay, so for instance, you can print a disc for an intervertebral disc for disc replacement for a patient. We don't have to go and look for measure sizes, but we can actually look at the patient and using MRI technology and all that, use the 3D printer to print exactly what we need for the patient. Okay, we have nanotechnology that is allowing us to deliver medicines at the molecular level, much, much more efficient. There's virtual reality, there's robotic surgery. As I also already mentioned, we have artificial intelligence in health. That allows us, for instance, to train an AI system to be able to look at hematological slides and be able to tell you that this slide shows that there are cancer cells here. Or for it to be able to look at CT scan images and tell you that this patient has got a pneumonia or has got a cancer, right? What this does is that if you are able to implement the artificial intelligence in healthcare, for instance, it frees the doctors to be able to do other things that machines will not be able to do. There's telemedicine or telehealth. Pharmacogenomics, our next speaker will talk about it, so I'll lay a lot of emphasis on. Then we have the wearables and the Internet of Things. This particular wearables and Internet of Things, I think that the COVID-19 pandemic offered us a good opportunity to be able to explore this. You remember that for the patients that we were able to send home, we asked them, for instance, to be able to check pulse oximeters, check their blood pressures, their pulse, and then send it to us. But imagine that the patients that we sent home had these devices as, say, your Apple Watch, that is able to measure your oxygen saturation, your pulse, and your blood pressure, and temperature, and would be able to send it real time to a doctor at a remote location. They are able to see it and monitor it, and maybe AI will be able to tell us when the parameters are going out of the normal range so that we can call them. Okay, so wearables are things that are with us now, and these functionalities are available and we can leverage on them. Electronic medical records are there. Clinical decision support systems, which is based on electronic medical records, help us to shape our practice of medicine. Okay, so for instance, if somebody has been listed as having an allergy and a doctor somewhere prescribes a drug that the patient is allergic to, the clinical decision support system can prompt the doctor to tell him that this drug that you are giving to this patient, the patient is allergic to this particular class of drugs, so it's likely they may develop an allergy. Okay. Your CDS is based upon the EMR, which is something that we should be looking at. Then obviously electronic prescribing, it's very important these days. Electronic prescribing ensures that, once again, we prevent a lot of wastage of drugs, right? And also helps the insurance companies that are currently being deployed in country and indeed in the rest of the world. But the HL7 is a standard that allows us to send information across different systems in a standardized format that everybody else understands. And therefore, it helps us in our management of cases. So quickly, we've already mentioned about electronic medical records. It provides real-time access to patient information. It gives us information about patients' medications, allergies, visits to healthcare providers. There's a record that tells us where the patient has been and when. Images and reports of images that have been taken, and then scheduling of services for these patients. Advantages they have over paper: they automate and streamline our workflows. They are readily accessible from anywhere. That is, if proper systems have been put in place. They do not require huge space of storage of patient records. I don't know if you've been to our records department in this hospital. It's an interesting site. There are lots of folders. Some of them have been soaked with water. If today we want to go back and do a retrospective study on our patient's folder, we will not be able to do it and do it properly because the data is simply not harvestable. But if we go to electronic medical records, for instance, these are things that you can easily do. Yes, technology can fail sometimes. So clinical decision support systems. All right, doesn't want to go back. Let's look at e-prescribing as well. I know that there's a policy that has been launched on e-prescribing, or to set up a framework for e-prescriber. E-prescribing is the next thing that we should be looking at doing. And this is the electronic transmission of prescription between a prescriber, a dispenser, a pharmacy manager, either directly or indirectly through an intermediary. And this can be done easily from our cell phones. Patients have cell phones, doctors have cell phones, pharmacists have cell phones. Systems can be built that can safely transmit prescriptions. We are able to safely check whether the prescription that is being given to the patient actually should be given to that patient. We have problems now with our insurance companies that refuse to give more than a month's treatment because they are not sure whether the prescription is really required and all that. But once we build systems like this, it's easy for them to look at the prescription, and then I, for instance, can write a prescription and say that refill this prescription 3 times. So the patient doesn't have to come to me anytime that they need to have a prescription refill, because in the system, it is there that the particular prescription that I have written should be refilled 3 times. There's also safety associated with it. Systems are built in it to ensure that certain drugs that may cause possible drug-drug interactions are flagged the moment they are prescribed by a prescriber, right? And as I've said, it could potentially save us millions of cedis that are lost every year in Ghana as a result of medication errors. All right, so we've spoken about HL7 already. Telemedicine. So telemedicine is a very interesting innovation that is currently ongoing, which is something that I think that would help both in the delivery of healthcare and in the training of medical students. Because in essence, what telemedicine affords us is that list or the consultants to be in a place where geographically it could not be possible. So telemedicine now, in our context, can be used for things like dermatology, radiology, and pathology. All right? We have very few dermatologists in this country, but there's no reason why remote clinics, be they district hospitals, regional hospitals, or even CHIPS compound, when they see a lesion on the skin, cannot take a picture and send it to a central repository where dermatologists can look at and help with making diagnosis. Same with radiology. We have lots of health institutions in this country that have X-ray machines, but there's no radiologists to be able to report on. This is something that we can help with. We can also do interesting things like EEGs, sleep studies, even ECGs that can be taken with our cell phones or scanners, sent to cardiologists in our tertiary and secondary centers for them to interpret and advise on what to do next. So telemedicine and telehealth offers a very big potential for us in our resource-constrained environment, where not only are we resource constraints in terms of specialists, but also we have places where we could have been are far away. But if we are able to implement this, we can transport them to an area where previously they didn't have accessibility for. Next slide, please. Then we have virtual reality. Now, virtual reality is a technology that allows a user to stimulate or experience a situation, an area of interest, using a virtual reality headset. The value of it is that it allows us to be transported to an environment where we can, for instance, conduct surgeries safely, and therefore can be used in the practice, in the teaching of medicine. If we look at, for instance, in our first years of medicine, the dissections that we did, this is something that virtual reality can teach us. So students don't have to be in a dissection room to do this. Students can wear a headset, and by the way, their lecturer can be somewhere and guide them on how to do these dissections. Okay, but it is virtual reality. They see, and then the teacher is able to, or the lecturer is able to guide them through how to do some of these procedures. It can be used to also teach surgery, right? And now with the advancement of the gloves that have some feedback, it also gives you a real-life experience. There's form in what you hold when you're in the virtual reality world, okay? So it has good advantages in terms of teaching. We can teach complex procedures by using virtual reality. And then we can also use it now for little surgeries, where the robot is at the other end of it, and you wear the headset and then do the surgery yourself. Next slide, please. So, are we really ready for digital transformation? We've already answered this question, but this particular slide tells a compelling story. This is Digital Ghana as at January 2021. And if you look at the total population, it's estimated that we have 31.4 million people, out of which 57.7% of us are urbanized. The number of mobile connections outstrips the number of people that are in this country, 41.6 million. That represents 132% of the population of Ghana have one form of mobile connectivity or the other, right? The number of internet users is about half of the population, 50%. And social media users is maybe a half of that, so 8.2 million, representing 26.1% of our population. If you ask me, we are more than ready to adopt digital revolution in our management of in medicine, because the people are ready. The people are already using this in different facets of life. They are using it for mobile transactions. They are using it for paying school fees, for paying bills, right? They are using it for government services, application of passports, driver's licenses, and all that. So we are ready, and therefore we need to take that step forward to be able to do this. Some successful implementations that I've already seen is that you have electronic medical records in some hospitals, 37 Legon Hospital, Yahoo Medical Center, the Trust Hospitals, and some of the CHAG hospitals as well. In Korle Teaching Hospital, I think we are still very much in the infancy, in the actual implementation of the electronic medical record for meaningful use. And all the time I say it must be meaningful. It's not that you have it, but it must be used meaningfully. And that's the thing. One of our alumnus, Dr. Kweku Amehu, I met a couple of years back, was doing some fantastic project at the South Bay district called the Bisadok, where he had a case that had various gadgets. Like, for instance, he had one that had an ultrasound machine that nurses could be trained to conduct an ultrasound on pregnant women, and those images are transmitted to a consultant anywhere in the world for that matter. But you can imagine, could it be in Accra? That can help look at the state of the baby whilst in utero. You also have things like an otoscope that could look into the ear. And if you look at the concept, really, there are lots of things that you could do with that particular setup. So that was Bisadok. It's been a while since I spoke to him. Maybe I should catch up with him to find out how his project is going. And then there are other systems that I've been involved in. For instance, John Snow International built, it was even text-based system that was used to manage pharmaceuticals to prevent stockouts. Simple text messaging to tell you what sort of stock you've got to help them plan the deliveries of essential medicines. So I think that, for me, we should really look at getting involved with these advancements in technology with regards to healthcare. So I know people will say that the technology is not out of our reach. Should we not be focusing on the brick and mortar aspect of our medicine? People say that we haven't achieved equitable access to healthcare. Why do we want to bother with these fanciful things? And that we should rather be focusing on training more healthcare professionals to tackle with the basic problems that we have. And my answer to them always is that, but these technologies that we actually are talking about, if we invest in them, we'll make all these things achievable in a much shorter period and more effectively. So let's look at some of the barriers that we have to the adoption of digitalization in healthcare. The truth of the matter is that the technology does not always address the issues that we have. More often than not, we tend to throw technology at a problem, rather than understanding the problem and then harnessing the power of the technology to solve the problem for us. So people say that we need an EMR, and so we go and purchase an EMR from anywhere and then come and dump it there, expecting it to work. It would not work. Because in order for you to deploy something as complex as this, we ourselves need to understand the problem. We must answer the question of the problem and then get the technology to work for us. Unfortunately, more often than not, we do the reverse. We take the technology and then we throw it at the problem, and then it fails. And then we keep on going in that vicious cycle over and over again. The other thing is that nobody wants to pay for these technologies. Yes, they're expensive, but we haven't taken the time to understand the cost savings it will give us going down the line if we should implement them. People also believe that the technology will create barriers between physicians and patients. I think that to some extent that is true. Okay. For instance, during the COVID era, Department of Medicine, we decided to do remote clinics. and patients will dial in, or we call them, we have a video call, we discuss some of these problems. And it's non-tactile. So sometimes you are not able to get the feel, and patients are not always able to tell you exactly what they are going through. And that is the importance of being able to do a physical examination. Unfortunately, a lot of our language is very difficult to translate into medicine. I don't know if anybody has ever conducted a spirometry in tree before. It is very difficult because you have to give some instructions, and even translating the medical term to normal language is difficult. Okay, so that loss of the personal touch is real, and we must look at ways in which we can address this whilst we look at implementing these technologies in medicine. I also believe that it takes up too much time for physicians. If you ask me, I think that a poorly designed system will take up a lot of your time. That is why it is important that we understand how we practice medicine and then build the solution to enhance our ability to deliver. Otherwise, yes, it will consume our time. And once it starts consuming our time, the next thing is that we will circumvent the system. And there are many systems now that are being circumvented because they are just too cumbersome. As we've already said, some feel that it's a little bit impersonal. The last one, which I have witnessed, is that it prevents a lot of pa. And so, maybe not us as physicians, but the other auxiliary health staff do not like it because it sort of blocks the leakages, and therefore there's a big temptation for them to want to sabotage it. So they will tell you that it's not working, it's not doing, they'll find all sorts of reasons why it shouldn't work. But that is one of the biggest challenges to the adoption of digitalizations. So the World Economic Forum on Africa really did recognize that Africa as a continent is best positioned to benefit from this digital revolution than anywhere else in the world. And in doing so, they recognize that there are certain things that we need to do as a continent to be able to harness the power that digitalization brings. So for instance, they are recommending that we should strengthen our capacity for conducting basic research and clinical trials in Africa. Many a times we rely on research and trials that have been done elsewhere, forgetting that we have unique characteristics even in our genes that make some of these findings non-applicable to us. And it is only when we ourselves are conducting our own research and our own clinical trials that we will be able to make good judgments and prefer solutions to our own problems. In order for us to be able to do that, we must invest in technology. We must also promptly implement our research findings. It is said that our university libraries are a graveyard for very good research work. Indeed, colleagues from other African countries make the joke that you let the Ghanaians do the research, we'll go and take them and implement them. And then by so doing, they leapfrog us. But we should have a positive culture or a deliberate culture to implement our research findings that we conduct. They're also recommending that we standardize our procurement across the regional blocks so that we buy standardized equipment so that it's easy for us to share knowledge across, which is also very important. We should harness the power of new technologies, and then we should look at high-level national policy directives in all that we do, so that there must be a national-level policy directive to ensure that we harness the technology that is currently available to us. Next slide, please. In wrapping up, I want us to look at the Kodak story. It has some interesting lessons for us to learn. Kodak used to be the photography company back in the 1980s, right? They actually invented the first digital camera in 1975. And then other companies used their technology. But Kodak failed, and failed miserably. And the reasons for which Kodak failed was that their core competency became their core rigidity. They were so good at producing films that they were too rigid to move away from films, even though they were the first people to invent the first digital photography. When they realized that this was happening, it was too late. They didn't do enough market research to understand where it was going to. And ultimately, there was unwillingness for them to change. So in 2012, they actually filed for bankruptcy. And that company, that coined the word Kodak moment, which was in reference to a moment that was worth capturing on picture to store for a very long time, now had that same term, the Kodak moment, as a warning for people who refuse to change. Let us not have a Kodak moment. Next slide, please. So lessons learned, we've already said that there's still a lot for us to do as an institution. A large proportion of our students come from other African countries because they have seen something in us. We are the creme of medical education, at least within the West African sub-Sahara region. But we haven't changed, and there's a need for us to change. There's a need for us to be able to innovate and harness the technology that we currently have at our disposal. And we really do have it at our disposal, so we must use it. Next slide, please. And I think that's the last one. Quickly looking at 5 impactful technologies that we should be looking at. We've already mentioned a lot about them. Artificial intelligence, deep learning technologies that allows us to analyze data and learn from them. The Internet of Medical Things, like we said, the wearables. Blockchain technology when it comes to supply chain for drugs. And then, as we've already mentioned, virtual reality. So in my conclusion, I leave it with this graphic of an old doctor whose room, as you can see, is full of medical records. And he telling his nurse that all this talk about EMR and EHR is just a fad. It's like the internet, it won't go anywhere. We know where the internet went to. And now currently, you have a physician that is telling his patients that he wants to see how many likes his diagnosis has on social media before he shares it with his patients. Thus far we have come. Let us innovate, and let us innovate so that we can practice medicine safely and create the next generations of doctors properly. Thank you.